First tonight, in the last 18 years, more than 200,000 children have been born or adopted into Maine.
Each and every one has been able to start a collection of books thanks to a statewide program called Raising Readers. It is one of the largest literacy programs in the country, and it begins at birth.
Every corner of the state, more than 1,200 medical providers, regardless of their affiliation, is involved in this, and the results are staggering, proving it really does take a village to raise a child, and this program is one of many healthy first steps.
Knock, knock. Hi. Hey guys, how's it going?
In this Maine Health exam room,
Ryan, how are you?
A wellness checkup isn't exactly high on a 3-year-old's list of fun.
I'm back, I know, and guess what? I've got a present for you, just for coming to see me today.
Unless you're a 3-year-old in the state of Maine.
What's that?
A bear.
A bear. What's he doing?
Dr. Brian Youth enjoys these visits because a doctor armed with a picture book is a little less scary.
Right?
I read that book.
Wow, you do, yeah.
The book is Ryan's to keep thanks to a program called Raising Readers.
Every visit from birth until age 5, kids get a book in the office.
Every kid in every part of the state at every checkup.
The reason for the book is really to sort of share the importance of reading and the importance of early reading to kids, and how, even when you read to a kid who's 2 months, 4 months, 6 months of age, there's been data to suggest that that's actually helpful in terms of brain development. So it's sort of like a vehicle to talk about the importance of reading with kids and families.
He has twin sisters that are 6, and now that they're reading, they love to read to him.
Something as simple as a book has even changed the conversation within the exam room.
I'd say the things that we spend the most time talking about with families now are brain development in terms of reading, good oral health, good healthy habits. Those are the kinds of messages and conversations we're having now, whereas in the past we had more conversations, I would say, around illness, and now most of our conversations are more around wellness and what keeps you healthy, and both physically and mentally.
In 18 years, Raising Readers has given out more than 2.5 million books to more than 260,000 Maine children.
I'm just going to give you one of my personal favorites.
Deborah Dietrich with Maine Health was there for the very start.
We thought about creating a program where the Libra Foundation would actually give the money, all of the money, frankly, to buy the books. And we started out this program with a very small pilot at the Barbara Bush Children's Hospital at Maine Medical Center. We hired a woman who was a children's librarian, had a background in public health. We started out putting books in the trunk of her car, okay, and taking them around to physicians' offices and giving them instruction about how they would give out the books and counsel parents about literacy and reading, the importance of starting at the earliest age.
And it continues because of the Libra Foundation, which is a charitable organization founded in Maine.
The Libra Foundation gets fan mail all the time from parents. It used to come in the form of cards and letters. Now it comes on Facebook and Twitter and Pinterest, etc.
In its 18 years, Raising Readers has gotten sophisticated. Doctors order what they need through a system online. Books are packed onto a truck and distributed to hospitals and practices, just like tongue depressors or medication.
And the books are chosen by a committee of doctors and nurses and educators and researchers and parents, so that they are incredibly just right for a child at that particular age.
A rhyme and a reason for each story explained to the parents when handed over.
I'll see a child in the office who's 9 months or 12 months, and the family might say, oh, they don't read books, they eat the books, or they throw them or whatever, and that's fine. You're basically having the conversation that you want to have a relationship with books.
The question is the statewide program working?
Maine was identified a couple of years ago as is the state in the United States that has the highest rate of reading to children.
If that's not enough backing for the program, ask a parent.
Even kids that are read to from birth, through age 5 makes such a difference, just in terms of, learning and doing well in kindergarten and being able to recognize pictures and words and all that. So.
I also have a son who was adopted just at the time this program was launched, and I watched him get those books from his doctor. I watched him start reading. I watched him become a voracious reader, over time. And I think he's in college now, but he was one of the first groups of kids to actually participate. So I saw with my own eyes the power of putting this into the healthcare system and having doctors and nurses who understand what the power is of reading and literature and vocabulary.
As they arm each and every parent with more tools to raise a healthy child in Maine.
Can you do a high five again?
High five,
one more?
because you did such a good
You
job.
did a great job. Yeah.
It is a really, really cool program, and clearly everyone involved is very, very passionate about it.
You will find no bigger champion of reading than yours truly.
Exactly, yes, so you understand. By the way, the Raising Readers website is also packed with a lot of helpful tips and tools for parents, and they have a list of recommended books for certain age groups, which, by the way, comes with a description on why the book is such a good read and how to read it to your child. You can find a link to that on our website or our mobile app.
Good to see.